Antimuscarinic drugs, commonly referred to as parasympatholytic agents, have a wide range of clinical applications due to their ability to block muscarinic receptors. These drugs work by inhibiting the effects of acetylcholine on the parasympathetic nervous system, leading to decreased activity in smooth muscles, glands, and the central nervous system. Atropine, the prototype drug in this class, is used in various scenarios, including pre-anesthetic medication to reduce secretions, the treatment of organophosphate poisoning, and counteracting cholinesterase inhibitor toxicity. It is also effective in managing vagally mediated bradycardia and dilating pupils for eye examinations. However, atropine must be avoided in conditions like prostatic hyperplasia, urinary retention, and narrow-angle glaucoma, as it may exacerbate these conditions. Scopolamine is another key drug in this category, notable for its sedative properties and its efficacy in preventing motion sickness. In higher doses, it exhibits anti-nicotinic effects and may cause hallucinations in susceptible individuals. Short-acting drugs like tropicamide are preferred for rapid pupil dilation during eye examinations, while longer-acting agents like atropine and homatropine are used for chronic conditions such as uveitis. Additionally, drugs like ipratropium and tiotropium are invaluable in respiratory conditions like asthma and COPD, where they reduce bronchial constriction and secretions by blocking M3 receptors in the lungs. Benztropine, biparidine are used in Parkinson's disease to reduce cholinergic overactivity, effective in controlling tremors and rigidity. In the gastrointestinal system, drugs such as parenzapine and tilenzapine target M1 receptors to decrease gastric acid secretion, making them useful in treating peptic ulcers. Similarly, dariphanacin and solifenacin are employed to manage overactive bladder and urinary incontinence by acting on bladder detrusor muscles to reduce overactivity. These drugs selectively block M3 receptors, targeting the bladder. Hyoscine butylbromide, another antimuscarinic agent, is commonly used to alleviate gastrointestinal spasms in conditions like irritable bowel syndrome. Oxyphencyclamine, dicyclamine, and adiphynine work as antispasmodics by blocking muscarinic receptors in the gastrointestinal tract. Their primary action is to reduce spasms in the smooth muscles of the stomach and intestines, making them effective in conditions involving gastrointestinal discomfort or hypermotility. Oxybutynin and flavoxate block muscarinic receptors to prevent urinary system spasms. They are commonly used in managing overactive bladder and conditions characterized by involuntary bladder contractions, thereby improving urinary control and reducing urgency or incontinence. Glycopyrrolate is a muscarinic receptor antagonist with stronger effects on reducing secretions compared to atropine. Its inability to cross the blood-brain barrier makes it more suitable as a pre-anesthetic medication. This characteristic minimizes central nervous system side effects, while effectively controlling salivary and respiratory secretions during surgical procedures. Cisatracurium and succinylcholine are neuromuscular blockers and used during surgeries to relax muscles, aiding in procedures like intubation. Despite their clinical benefits, antimuscarinic drugs can cause notable adverse effects. Common systemic side effects include dry mouth, blurred vision, tachycardia, and urinary retention. Cycloplegia and prolonged mydriasis can worsen pre-existing glaucoma, while central effects like hallucinations, confusion, and delirium are more pronounced with tertiary amines like scopolamine. These drugs must be used cautiously in elderly patients and individuals prone to hyperthermia, as they inhibit sweating and thermoregulation. In summary, the therapeutic applications of antimuscarinic drugs are extensive, as shown in clinical practice. Atropine is the primary antidote for organophosphate poisoning and is also used to manage bradycardia caused by digoxin toxicity. Scopolamine effectively prevents motion sickness, while drugs like benztropine and biparidine are employed in Parkinson's disease to reduce cholinergic overactivity, controlling tremors and rigidity. Tropicamide, due to its rapid onset and short duration, is preferred for ophthalmic procedures requiring pupil dilation. Ipratropium and tiotropium used in treatment of asthma and COPD by reducing bronchoconstriction. Pirenzapine and tilenzapine reduce gastric acid secretion, treat peptic ulcers. Hyoscine butylbromide alleviates gastrointestinal spasms. Dicyclomine and atropine are an antispasmodics for hypermotility and discomfort. Darafenacin and solifenacin manage overactive bladder, reduce urgency and incontinence. Oxybutynin and flavoxate prevent bladder spasms, improve urinary control. Glycopyrrolate used as pre-anesthetic medication for secretion control. Does not cross the blood-brain barrier, minimizing CNS side effects. Cisatracurium and succinylcholine relax muscles during surgeries. Aid in procedures like intubation.